Hey, everybody, welcome to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. Right before we got on air, I asked Emina about the one house bill, which I was expecting, but I didn't realize came out yesterday because I was stuck at an airport. Emina, we have a lot to talk about this week, so let's get going.
Yeah, let's start first with that one house budget. I'm going to go down the list of various items that were proposed by the executive and where the Assembly and the Senate stand on each. So in no particular order, but I will start with the CD PAP. There was nothing in the executive budget proposal covering changes to CD PAP. There was nothing in the Senate and nothing in the Assembly. So there are a lot of rumors out there about there being a 3-month delay. I can't tell you how many clients have called this week to ask me if it's true. It is not true, folks. That is just a rumor. And it's buttressed by the fact that there's nothing from the Senate or the Assembly, despite all of that PR, all of that complaining, all of those outcries. There is nothing from the legislature indicating any sort of a delay. So April 1 is still on track. Next, there was an ask by different associations for 70 million in CHHA funding. The executive had nothing in her budget for the CHHAs. Senate had 30 million and the Assembly had 30 million. So there's a possibility that that will pass. The hospital at home idea that would allow hospitals to provide off-site acute services at home without Article 36 authorizations. Again, this is something that the executive did push for. It was defeated last year. The Senate, it adopts that language, but with a 2-year expiration. I don't know why that 2-year expiration would actually expire after 2 years. I'm sure that if it was implemented and 2 years in, they would just extend it. So to me, that just looks like an adoption of the executive's proposal. And then the Assembly omits this entirely. They reject it. So they do not have this in the Assembly. So this may be an item that will be contentiously disputed. The next one has to do with the MLTC and PACE quality pool. The executive's budget eliminates the quality pool. The Senate and the Assembly restore it, but the amount that will go into the pool is not clear. The other item of note for our listeners has to do with the NHTD cap. As we know, this program has been growing. And so this season, we've heard of there being significant delays and stalls on further enrollment. Now, as far as the executive's proposal, she capped NHTD program through administrative action. So she was looking to cap the amount of enrollees in the program. The Senate rejected this and added $182 million to restore access for new enrollees. The Assembly didn't do anything with this. The next set of proposals has to do with workforce matters. There is a nurse licensure compact. If you remember, this was proposed last year. It did not go through. The governor authorizes New York again to join the interstate compact, which would allow more out-of-state nurses to come in and work in New York. This was in the governor's budget this year. The Assembly and the Senate have rejected it, both. So this may not go forward again. There was a program, again, proposed by the governor, $3 million was reappropriated into a program called Nurses Across New York. And on this point, all three branches are in agreement. So Senate, Assembly, and the executive agreed to put in $3 million into this program. The other workforce proposal that was in the executive's budget that did gain approval from both the Assembly and the Senate has to do with increasing training capacities in statewide healthcare facilities. It's a grant program. The executive's budget appropriates $22.5 million for this program, and the Senate and the Assembly agree with the same amount. So this may pass. One of the proposals also that has to do with workforce was renewing funding for caregiver flexibility for direct care aides. And this one may pass as well. The executive allocated $39 million for this. The Assembly and the Senate agreed. And then additionally, The executive proposed renewing funding for financial burden relief for healthcare workers. And the executive allocated $47 million for this program. The Senate and Assembly agreed. So this may pass as well. And that is it, folks, as far as what is relevant to home care from the budget, the executive's budget, as well as the Senate and the Assembly's response. Sasha, comments, feedback?
I really have no comment because it's things that are just keep coming back. I'm pretty surprised that the out-of-state nursing came back because there was no real conversation around that. I didn't expect that to come up. I thought that was dead in the water, but I guess in Albany, nothing ever goes away, or you're moving pieces, right? I guess maybe that's the answer there, right? Legislation takes forever to happen. It could be over several years and decades even, and maybe that's it. There's somebody who keeps reintroducing these things. I personally think it could be a good thing for New York, as New York is a destination state. If I were in a neighboring state, I might worry a bit more because then the competition would be drawing people away from, as I know a lot of healthcare workers who live in the Poconos. I don't know how they do it, that they come to New York and work, but they want a different environment for their kids, and that happens. So I would think that that would continue to happen in our industry and to our benefit. So that's one of those things that I would like to see moving forward. Another thing, Amina, that we want to bring up as the results of the One House bill is there is no mention of anything that we went up to Albany to discuss with the HCP Advocacy Day, right? We know there was the $150 million to be allocated from the MCO tax, right? These funds are coming. Their tax was collected and will continue to be collected, but no allocation for home care. There was no mention of the Paulin Rivera bills to improve reimbursement rates and set a minimum regional reimbursement rate. There is, again, no repeal of fiscal intermediary and single FI. That's moving forward. And there is no mention of the Gonzalez-Rojas bill, which would call for transparency in home care. So big fat zero for home care this legislative session. Next, well, there were a bunch of administrative movements and things that happened this week, right? There was the DOH cease and desist letter to the FIs. I mean, I know you wanted to talk about that. A lot of clients are, well, I didn't get one. I don't know. I think it was specifically to those who were bad actors and were reported to the Department of Health. So, Amina, could you shed some light on that, about who could have and how was this distributed?
So yesterday, we're recording this on a Wednesday, but on Monday, late in the afternoon, the cease and desist letters were sent out to providers. There were 17 providers, very large FIs. The majority of them, if not all of them, are LICSAs as well. And the letters were then compiled into a single PDF, and under the cover letter of the New York State Department of Health Commissioner McDonald, they were sent to all members of the legislature with a cover letter that says, we've sent cease and desist letters to these 17 FIs who are engaging in false deceptive business practices of misinforming the consumers and the PAs that they can switch out from the CD PAP program into the LICSA program. I think what the state is trying to say is that, look, if our transition is not going well and someone gets hurt, as we've talked about, it's not our fault. It's the fault of these bad actors because they're spreading misinformation. And the letters actually threaten these agencies with LICSA revocation if they continue engaging in these practices. Now, the letter was sent to the members of the legislature, as I said, but included at the end of the letter was the health person out of the governor's office, like the key person in control of health. And so this has really hit all of those segments of government. You don't want to be on this list, right? And I've spoken to a number of providers that are on there. And first of all, the information is outdated. a lot of those operators are wrongly listed. Like you know they've been in a management agreement for years. So it is the wrong recipients listed on those letters. But I've talked to them and I said, "Are you doing this?" He's like, "No, we did none of this," you know? Some of them are even subcontractors, the PPL subcontractors. So they have some splaining to do to not only the state, but also to their contracted partner, PPL. I don't think the state did any due diligence on this, frankly. They put these agencies on a really damning list. And the few I've spoken to, I said, you should be sending a rebuttal to everybody that's copied here. And by the way, you may want to consider calling out the Department of Health because they've broken quite a few laws themselves in this process. Forget the things that are being litigated right now, the corruption and the violation of public bidding laws, forget that for a moment. But for example, the state's insistence that providers disclose confidential employee information to plans. Plans have no legal right to your list of employees, to their contact information, to their personnel file. PPL has to hire all these people anew. They do not just get to benefit from a personnel file that you've maintained all these years, that the relationships that you've cultivated with this staff for all these years. And certainly you as a business owner cannot be compelled to disclose this confidential personnel information under the threat of what? Licensure revocation? Come on. The other thing that bothers me is their disregard of federal I-9 requirements. They expect the folks to just receive this personnel file and to move these workers from one payroll to PPLs. Again, these people need to be hired from scratch by PPL. Okay, they cannot just inherit the I-9 work that the current FI has done. New York State Department of Health does not have the jurisdiction to waive federal I-9 requirements of the federal government. Sorry, get in line, stay in your lane. So to me, it's a little bit funny that the Department of Health, the commissioner, is acting huffy-puffy, indignant that these FIs are supposedly violating the law, when all along this has been an example of what not to do.
Well, I think it's a very political action taken by Department of Health, and it's brilliant in a sense that they are kind of giving themselves some political cover if it does uh, mess up. I was going to use more colorful language, uh, but I mean, I think it again. That's brilliant on their part. And as you were speaking, I was thinking about the transition of personnel files, and if PPL just uses those documents and doesn't hire a new, would you recommend that we terminate that have a letter to terminate these employees so as not to open yourself up to co-employment issues, right? You want a clear separation, even if they're taking your documents and then putting it in their folders. Work like that might be a simplistic kind of explanation of what's happening, but I would want to end my relationship with that employee clearly.
So Sasha, actually, that's a very good question, but the answer is a little bit more straightforward than what the question suggests. All businesses in New York State have an obligation to provide what's called a 195 letter upon the separation of employment, whether it's voluntary termination, a layoff, or a resignation. But the letter has to be received by the employee within 5 days of the termination of employment. And there is a termination here, right? Whether we are the employer or not, the employee, there's someone's employee, has to get that letter. The purpose of the letter is to define definitively the last day of employment and the impact of the end of that employment on the employee's wages, benefits. If there's any accumulated PTO, it has to be in that letter. This is how much time you have, and this is when we're going to pay it out to you. For those folks who are wage parity covered, you have a big balance there. Who's going to pay that? And it is not legitimate to have a rule that says you have to let us know if you want this payout. No. No. If you've been taking wage parity credit for their PTO and they got a balance, you have to pay that out no later than the next pay date. Sorry. Unless you want to take some risk, right? You need to speak with your counsel. There are definitely many agencies who have said, I'm going to be quiet on this because I've got a big balance on my book and I'm not going to say anything. So thanks, Emina, but same thing with the wage parity benefits, folks, by the way, and we'll have Paul Esner on the call. Some of your caregivers have a lot of balances on their cards, right? There are very, very specific IRS rules about what balances continue after employment ends. There are some rules like transit, you can't be using those cards in transit in perpetuity. Those end after employment. Same with reimbursement for qualified health expenses. There are limits on how long those survive the termination. So make sure you speak with your benefits counsel, your insurance broker, whoever is administering these benefits. And if they're one of those wage parity vendors, get their input, but then talk to a lawyer because I don't trust what they say. So these are some of the after employment impacts. And sure, we can try to pretend that there's no joint employment, but for a lot of these statutory obligations like workers' comp, unemployment insurance, the law says you are the employer. So it's a bit of a losing argument. But if you want to hang your hat on that and say, I didn't provide it because they're not my employee, I guess I'll have to litigate it at some point. The other thing that I want to just emphasize, and I know most companies listening to this understand this obligation, but there is an unemployment insurance form that the New York State Department of Labor publishes. You are supposed to give this form in the ordinary course to any employee that you have terminated, laid off, who's losing their job as a result of this. It gives them your employer UI number so that it is easy for them to file for unemployment. We've talked about the darn unemployment consequences of this PPL transition because there will be a lot of PAs who have not registered. If you remember from either my newsletters or the conversation Sasha and I had a few podcasts ago, there's only about 2,000 PAs at most who have registered to work in this program. There are a lot of PAs, a lot, who will not register and who will have some gap in employment after April 1. They will be going to unemployment insurance and filing for benefits. You are supposed to make it easier for them by giving them this form that gives them the employer unemployment insurance number, because you each have a unique UI number in New York State. Again, this is one where clients have told me, thanks, we ain't doing it. So please consult your counsel before you decide.
To your earlier point, with the cease and desist letters, like, the mission has been accomplished, right? Because there's a lot of conversation with the aides that they don't want to move. That message has gotten across and it's muddying the water, and it's going to negatively impact the agencies with this unemployment insurance, likely. So let's move on. We are 2 days removed from the elder plan deadline of submitting information about the PAs. They wanted a worksheet. We actively participated in giving them the information that they requested. But then you have other plans, which I won't name, who are calling agencies and submitting their own worksheets to assist with transitioning the PAs and the CD PAP members to Licensure. So, a little bit late to the game, but again, I've said this many times on the podcast. They're realizing that there's a negative financial impact to their companies, and they see the benefit to working with us and actively, like they've started reaching out on their own proactively prior to us, and they want us to kind of close the deal. So, Emina, and what are you hearing? Conversations or having conversations with your clients, or in Albany or in the industry?
Sasha, I'm actually surprised by this because there have been a number of cases where clients have told me we have patients and PAs who are ready to switch out of CD PAP, but the plant won't let us. And granted, it was Anthem that wasn't letting patients have their choice because, they got a sweetheart deal with PPL. And by the way, for those who haven't heard yet, apparently the rates are between 26 and 27.50 for PPL for CD PAP. So on the higher end of the spectrum of what I know a lot of providers were getting paid. But I'm surprised to hear that. And I think those plans are going to get themselves in trouble at some point because the next program that will be on the chopping block, we've already seen this happen with NHTD. We've seen it with CD PAP. It's going to turn to the LICSAs, right? They're going to try to limit enrollment or the amount of services that the current enrollees have because even according to an article from Cranes today, where they are reporting on this cease and desist issue, they're saying 30,000 people have moved out of CD PAP into PCA. 30,000. So that's a huge influx into the LICSA space. And again, I do think that the state will react. So if the plans are facilitating that transition into a more expensive program, I don't think it's going to bode well for them, frankly. Lastly, we're going to close out with a discussion about a advertisement that came out from the New York State Department of Health with PPL on the logo earlier this week. The state is offering a $100 incentive to personal assistants who switch from their current FI to PPL. And there have been a lot of questions about whether this actually constitutes a kickback. And interesting piece, folks, I am talking about kickbacks for the home care industry, but I'm speaking for the Pennsylvania Home Care Association, just a little bit of a plug. It is not a kickback to pay a recruitment incentive to an employee or a potential employee. And this is why the DOH can get away with it. They cannot pay consumers to come over. That would be a kickback. However, they can pay an incentive to a worker to come and stay in the industry. This is why nursing incentives are okay, right? State paid those out a bunch. Healthcare worker bonus, retention bonuses. So you can pay retention or recruitment type of incentives to staff, not consumers.
Thank you, Emina, for that. It's pretty straightforward that is allowable. The bigger question for the single FI is where's the money coming from, right? That's the bigger question.
Apparently from New York State. They have money to do this.
Yes, exactly. Well, I mean, look, I think we've talked about in previous podcasts about $50 ask for PPL, but now if it's closing in on a 26, 27 dollar rate, that seems a bit more reasonable. Maybe there could potentially be savings, and maybe we were victimized by the rumor mill in us understanding that it was going to be a lot higher on the reimbursement. So I guess we're at the end of the CD PAP. It's been a good run. Let's see if they extend the runway by delaying. Let's see if this 3-month extension actually comes to fruition. But other than that, yeah, we're going to move on to LICSA, trying to get out ahead whatever the LICSA RFO has in store for us. So that is it for us this week on Home Care Forum Podcast with your host, Sasha Guillaume and Emina Poricanin. Have a good one.